Literally, you could talk for hours and hours on this, and but just trying to highlight some of the big points, important ones for both taking care of patients and for, I think, clinical testing under the exam. Um, First of all, it makes up a lot of our calls to poison centers. This is in total. There's probably about 2 million calls to poison centers, and somewhere in the 40,000 range per year are for plants. The good news is most are in children and most are asymptomatic, and the number of people who have died from a plant exposure or ingestion is really, really small. We have seen a one or two at our shop, but in general, it probably go many years before you see somebody. So the good news is most of these can be treated conservatively, and few, if any, have any specific antidotes. So let's talk about some that cause some problems. This is one that grows locally, and this is about the right time of year to get those calls from them. The death camas. Those of you know, there's a city of Camas in Washington, just across the Columbia. They look kind of like a root you can forage for, like maybe onions or garlic, and this is how most people get in trouble. They dig it up, they think it looks like a good thing to cut up and throw into a stew or some sort of dish. Oh, gotta change it this way. Unfortunately, it's often mistaken for either wild onions or ramps. This is what it looks like. There'll be a lot of pictures here throughout the slide. It's got a nice, pretty kind of white flowering top, but when you go below the surface, it looks like that root. Um, the toxin involved, and sometimes just most of these are the name of the toxin matches the name of the genus or the species of the plant. So it's a zygodenous plant and has zygosine in it. Its mechanism of action is sodium and calcium channel openers. Now, most people don't get profoundly sick. They may have some nausea and vomiting, but not a lot in and of itself to send someone to the hospital. But they tend to get very lightheaded and dizzy because they progressively get bradycardic and hypotensive. And we've seen this in people who have foraged for it. So this is one of the ones that cause bradycardia. There's a lot of plants that cause bradycardia, and I'm going to talk about them first, and then we'll talk about the opposite, tachycardic, second. The sodium channel is the sort of the fast inward zero depolarization. I know Rob probably covered a little bit of this last hour, but it can be blocked either in its resting state or its activated state. And most of these do it in the resting state. So we had an article here where we had someone eat Zygodenus. Again, zygosine levels were done in another case. And basically, because of bradycardic, it follows pretty much standard ACLS. You can try atropine first, and that often works. But trouble with atropine is it doesn't last particularly long, maybe 20, 30 minutes, and then you have to give another dose. I don't think we have a way of doing an atropine drip per se, so we have to go to a constant infusion for both pressure support and heart rate support. Usually dopamine is the first line in ACLS, although epinephrine at a slow infusion state probably works as well. Most of these cases don't get profoundly hypotensive, so they need to go to a pure alpha strong agent like epinephrine is probably unlikely. But these are the plants that cause bradycardia that are common. So if they give you, I mean, I can see them saying something like, all of the following cause bradycardia except, and you'll have to pick out the one that isn't on the list, or all the following cause tachycardia except, and it may be one of these that are on the list. So the death camas or Zygodenus plant is first on my list. Hellebores are next, which are verathrums. And then less so, but still important, are the granotoxins, which are in the rhododendrons. Rob talked about the cardioglycosides. Obviously, that was all originally derived from foxglove. But we'll show you some examples of other cardiac glycosides besides foxglove. So first up is the veratrum species. The toxin similarly is named veratridine, which is a veratrotoxin. So they all have that similar T thing. It too is a sodium and calcium channel opener, not a blocker. Both of these are openers. Symptoms, this one has a little bit of nausea, vomiting, diarrhea, and a little bit of headache, and then it progressively causes bradycardia hypertension and some cholinergic-like symptoms. It's often mistaken this time for leeks, which are good for salads and soups and stews and whatnot. Here's some pictures of them. It's not a particularly interesting flower, it's smaller flower involved, but these are the various hellebores that are available. Here is a leek, really looks like an onion or a leek to me, and here is the hellebore. You can tell maybe by that one on the right, it may be easily mistaken for each other. The next up is the granotoxin, which is kind of interesting. There are lots of plants in the US that produce this, but the really serious granotoxin cases almost always occur in Asia and Europe. The rhododendron, which grows everywhere in the US literally, is a sodium channel opener. Again, azaleas are a genus of the rhododendron species. And clinically, if you eat enough of these plants, you can get bradycardia hypertension. Although I don't remember ever seeing anybody significantly ill from eating the leaves or roots or anything of rhododendrons or azaleas. Where we see significant toxicity is what's called mad honey disease. Mad honey disease is done from bees, usually feeding on a limited geography, which include rhododendrons and azaleas, and their bees in the honey concentrate the granotoxin. It's a granotoxin toxicity, and they can present with profound bradycardia and hypotension, again, needing resuscitation, same as with death camas, atropine first, dopamine second. Here are some pictures of the rhododendrons. Here's the azalea. These are nice flowering plants. Literally walking through homes and neighborhoods and parks, you will see this, especially soon this time of year. They'll be blooming pretty regularly. So the mad honey problem originally was described in northern Turkey, where there were select bee keepers that used flowering areas that had concentrations of rhododendrons, and they were able to, in one case report of 23 patients, show you that they were all hypotensive, many were bradycardic, many had nausea, vomiting, sweating, dizziness, and some other symptoms such as blurred vision also occurred. Again, treatment is supportive with standard ACLS and supportive care. I guess for nausea and vomiting, if you wanted to pick a drug, I would pick one that had some anticholinergic kick to it, because it would probably increase the heart rate enough that maybe you wouldn't need a constant infusion of dopamine or something along those lines to support it. Again, it's a sodium channel opener. It binds to the voltage-dependent sodium channel in its open state, so that middle one right there. The modified sodium channel is unable to be reactivated, so it slows the depolarization and slows the generation of action potentials, and then it basically causes bradycardia that way. The fourth one in the list of bradycardic toxins are the cardiac glycosides. This is foxglove. It's a really beautiful plant with pink or red or white hanging bell-shaped flowers like that. In fact, digoxin itself was derived by William Withering from the foxglove plant, sort of an extract in the days before we had true pharmaceuticals. It was used to treat dropsy, which was sort of the archaic term for swollen legs from heart failure. So basically, this was a drug for congestive heart failure, and in fact, still is, as Rob mentioned earlier. Dig is the main drug for heart failure. Again, close-ups of the foxglove plant. It is called Digitalis purpurea. That's where digitalis comes from. But there's some other ones in this family of cardioactive glycosides. that don't produce digoxin, but produce other cardioactive glycosides. Probably the one that's most prevalent in the US is oleander, or Nerium oleander is the exact name. These could be white, pink, red flowers. They can grow quite tall, often in the middle of freeways, are planted there on purpose. Certainly in California, there were. Here is some pictures of the yellow oleander, which is a different species, grows a little bit more in Asia and the Pacific. This one is not so much of a bush, but can actually be a trunked tree that can grow, 30, 40, 50 feet high with a bright yellow flower. There's a famous one in a park in Hawaii called the Be Still tree. It was used for its suicidal purposes, distraught, whatever. People would go there and pick the yellow flower to kill themselves. It contains the toxins tivecin A and B. They are not digoxin. They cannot be measured with a digoxin assay. With a foxglove ingestion, you could potentially get a digoxin level that might be meaningful, but these are less, do not cross-react with that toxin. You just have to treat based on clinical symptoms of bradycardia. Yet another plant in the cardioactive species is the lily of the valley. These are these kind of hanging bells. Here's another one. This is the suicide tree from Asia, or the pong pong tree, grows in Eastern Asia. I don't think these are likely to be on the test, but these are some other ones that also contain different cardioactive glycosides in the Cerbera genus species, and they have these nuts that can be ground and made into cardioactive toxicity glycosides. The last one, which almost never people like it because it's got a kind of clever name, but it's this onion-like plant with a brown root called red squill. But I've never seen or heard of a case of this, but it seems to show up on tests for some reason due to its fascinating name. So digitalis comes from foxglove. It's sort of the poster child for all these cardioactive glycosides. It has three basic actions that we think of. We think of it using pharmaceutically. It's a positive inotrope, therefore increasing the force and strength and velocity of contractions. It's a negative chronotrope, so it slows the heart rate down, therefore may be used for things like AFib to slow the heart rate down to a reasonable level. By this, it will improve coronary blood flow and perfusion. And it's a negative dromotrope, which means negative conductivity. So someone who has a fast heart rate that's conducting through the ventricles that is also responding fast, it will slow that down. So this seems to be a perfect drug for people with AFib and heart failure. Increases the strength of contraction by slowing the rate and the conductivity of the fast firing atrial node, SA node. It works as, again, Rob probably went over all this, the sodium potassium ATPase pump that, and the sodium works also via the sodium calcium exchanger. So basically, it seems to be almost a net result similar to the sodium and calcium openers that we see in the other plants like death camas and granotoxin. Here's a blown up of that same picture. You could exchange 3 sodiums for 2 potassiums. So you could get, if that is blocked, that sodium potassium ATPase, you can't get potassium into the cell. Therefore, you have extracellular hyperkalemia. That may be a clue on a little scenario that you get. You also block the sodium calcium exchanger. Therefore, calcium builds up inside the cell and causes calcium mediated calcium release that essentially interacts with actin, myosin, contractility, and therefore improves contractility when there's increased calcium inside the cell. This is sort of one of the reasons we say don't ever give calcium for hyperkalemia, because intercellularly the patient's already fully flush with calcium due to the toxicity of the cardiac glycosides. So there's increase in extracellular potassium is a clue, which you may see in a lab, but you may not see low sodium or low calcium. That's just a known what's going on inside the cell. Chronically is what we usually see, not so much with plants, but with people who take the drug chronically and get dehydrated or have a second drug that impairs its renal secretions, since it almost is excreted 100% by the kidneys. You get these visual color changes. People have speculated that Vincent van Gogh, when he saw halos and bright lights around things, was probably being overtreated by his doctor in the asylum he was sent to with foxglove, and therefore in later life saw everything in yellow halos. That is, in fact, his doctor. He painted several pictures of him, of Dr. Gaucher holding the foxglove plant, suggesting that's what he was being treated with. The other artist that's associated with ditch toxicity is Salvador Dali. Not that he was poisoned in any way by digoxin, but he has this very interesting, strange mustache. And in fact, that's what's called the Salvador Dali sign, which is this deeply scooped version of the ST segment that's suggestive of dig use, not necessarily toxicity. So you can have a Salvador Dali sign just from chronic digoxin or other cardiovascular cardiac glycoside toxic use, not necessarily poisoning. The treatment, as we talked about, is digifab, which are these FAB uh, uh, portions of the immunoglobulin. Um, each vial counteracts about 40 milligrams. That contains 36 to 40 milligrams, and they can be used according to a sliding scale. In general, with plants, it's probably unusual to need more than 2 vials because you really need a lot of cardiac glycosides in order to get that sick. I guess if there was someone who purposely took a suicide tree ingestion and it ground up a bunch of those seeds and nuts and took it all at once, I mean, you could may have the need to go higher. The problem is there's not a lot of cross reactivity between digifab and oleander and thyrethrins, and although we use them, they're often ineffective in these other cardiac glycosides. But I think it's reasonable as a first line therapy to give it a try. So what about tachycardia? This is the opposite. Those are the big four for bradycardia. These are my big four for tachycardia. There's a lot of plants that have anticholinergic properties. There's monkshood, which is a carnitine or a conite, and then things like nicotine and caffeine, which we're more familiar with as cigarettes and coffee. The anticholinergic toxidrome should be well known to you. The little poem, dry as a bone means dry skin, red as a beet means flushed, hot as a hair means temperatures increase, blind as a bat means pupils are dilated and can't see very far away because of that. Mad as a hatter is it the delirium that occurs with it, and the tachycardia is part of the anticholinergic toxidrome, along with decreased GI motility, so decreased bowel sounds and decreased GU motility, which may even lead to urinary retention requiring a Foley to resolve. The classic drug for this is Datura, stramonium, which is Jimson weed, but there's also other ones. Most of these contain variations of scopolamine, atropine, and omatropine, depending on the actual plant. And there's lots and lots of plants that are the anticholinergic group. This, I think, is the Jimson weed. This is more Jimson weed, Datura stramonium. Early on, it has this nice single white flower, and then later the seed pod that opens up with lots of seeds in place. More pictures of Jimson weed. Typically, people are not mistaking this for anything else. They are basically looking for this to kind of get high. So almost all the other plants that people forage for, they mistake it for onions or roots or something and maybe edible. Jimson weed almost all of the time ends up being teenagers or even 20-year-olds, I guess, that are looking to find the seed pod to make it into a tea or to smoke the leaves to make an anticholinergic delirium. And typically this happens in warmer weather and the hot as a hair problem happens. And this is whenever I hear of like 3 teenagers completely taking their clothes off in some wooded park area somewhere, almost always I think of Jimson weed as the culprit. But there's others. There's a variety of berries out there. The atropine belladonna is the deadly nightshade. So atropine comes from these berries. Belladonna means beautiful lady in Italian. Supposedly the thought is the dilated pupils of atropine make someone more beautiful. And in fact, it was used as eye drops or ointments throughout, European history as a cosmetic agent. But if you take enough of it, you have, as I mentioned, atropine, scopolamine, and isocyanine in the different parts of the plant, and they're all capable of causing anticholinergic toxidrome. This is the American nightshade, the Solanum americanum. Again, both unripe green berries, ripe purple berries. Kids always seem to get into these and they get sort of this anticholinergic delirium, but for the most part, they do fine. I guess you could consider physostigmine for it, but most of these are usually just handled just with observation. Um, Again, the American nightshade has all of these in it, including solanine. Sometimes people like grouping the nightshades as a solanine containing plant, and you'll see it that in some textbooks, but really it's the scopolamine and atropine that causes the biggest part of the problem. The next plant on the list are the henbanes, the bane of hens. That is Hyoscyamus niger. Hyoscyamus has hyoscyamine in it, which is very similar to scopolamine, causes the same sort of anticholinergic toxidrome. Here's a picture of that plant, a leafy green with a cluster of white flowers with sort of a deep-seated brownish discoloration at the base of the stamen. So we get this call like every spring. I'm talking about ophthalmologic emergencies later in the year, and I'm using a similar slide to this one. I always get a call where someone is out working in the garden and they come in with a single pupil that's dilated, and they get the whole stroke workup in some emergency department with a CT, CTA, MRI, blah, 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 lots of labs, nothing's positive. And suddenly they think maybe it was pesticide poisoning. Well, it wasn't. They were probably, and I always ask, were they planting angel trumpets, which kind of go into the ground in the next month or so? And they probably rubbed a little bit of the juice from the flower or the stem in one of their eyes as they're working and maybe sweating, and they just have a unilateral dilated pupil. So let's move on to plants that can potentially cause arrhythmias. These are monkshood, Aconitum napellus. They're nice, bright purple plants. These are the bane of wolves, wolf's bane, as opposed to the bane of hens, henbane. They have aconite, is a sodium channel opener more so than a calcium channel opener. So that makes it a little bit different than the first four plants we talked about with bradycardia. You can get bradycardia sometimes with monkshood or aconitine poisoning, but the highest risk is biventricular ventricular tachycardia. So that may be a scenario where someone ate a plant or a salad and suddenly they're having lots of PVCs or different size PVCs. The onset can be a little bit delayed from minutes to up to 4 hours, and it can last for as long as a day. Initially, if you get them early, you might see that sinus brady, but ultimately they have this bidirectional ventricular tachycardia, where one QRS complex is up and the next one is down, and the next one's up and the next one's down. And it's basically there are two foci in the ventricle on different parts of the ventricle that are fighting each other for perfusion that is causing the tachycardia from multiple, usually at least two ectopic foci in the ventricle. Often these patients will have pulses with this. Sometimes they won't, but you want to treat these and observe these and fix their electrolytes when possible. Some of them also have CNS symptoms, depending on what part of the world monkshood is harvested from. The paresthesias may help you differentiate these from the cardiac glycosides. If given a scenario, they tend to have numbness and tingling in their lips and face, and some of them will even have hypersalivation and lacrimation suggestive of a cholinergic toxicity, but it is not cholinergic per se. Um, Pretty much for the ventriculars, everything's been published. Amiodarone seems to be the most common, but I think it's also what we usually use for stable ventricular arrhythmias. So I would put amiodarone as my first choice if given a what would I do next if someone ate this thing. Fixing magnesium, potassium is fine. Beta blockers may be acceptable. Flecainide may be acceptable as well, but I don't think they'll give you all those choices. There are multiple active metabolites of aconitine, mesaconitine, and high aconitine, and these can be detected with more sophisticated assays. So if someone presents with weird arrhythmias and a plant toxicity and you want to document what they had, you can send these off specifically. The other lethal plant that we see from time to time, and I know we've had at least one of those fatalities reported here in the last few years, is from the Pacific yew, the Taxus plant, who has these bright, kind of squishy berries with a blackened core in the middle. They grow here in the Pacific, not surprisingly, all the way up through Canada. They have a toxin from the Taxus plant is taxine type B. It once again blocks sodium and calcium channels. So again, this to put the distinction here, these are blockers of these channels, not openers like all the other plants we talked about. They present with nausea, vomiting, sometimes diarrhea, and often profound, severe, hard to resuscitate arrhythmias and seizures. Here is a set of what looks like going in and out of torsades from a case that was reported in the literature, where sort of those clustered beats going back to a wide complex QRS, going back to clustered beats of ventricular tachycardia. I mean, the treatment's mostly supportive for those. They may even need overdrive pacing if they're going in and out of torsade. Magnesium is the first line, but it's probably not going to fix this because hypomagnesemia is not usually the cause of taxine-induced ventricular arrhythmias. The other things that cause tachycardia are, and we recently just had a case of this with caffeine, which was disguised under being guararine or guarara, which is used in a lot of energy drinks. Theobromine also shows up in cocoa and chocolate. It's all part of the methylxanthine family. Caffeine is the trimethyl C3CH3 groups on that molecule, and it's often demethylated to several dimethyl caffeines, which include theophylline, theobromine, and less talked about paraxanthine. All of these work by um, inhibiting adenosine and causing tachycardia and causing tremulousness as well in the CNS. The guararine also is this bright red berry, mostly from South Africa. It's a very high, rich source of caffeine, but if you put guarara on your label of your beverage or food stuff, you don't have to list caffeine separately. So people try to do that to sort of fool you a little bit. They may have up to 3 times the amount of caffeine as a typical cup of coffee. So caffeine has at least 3 important mechanisms of action. One, it's a phosphodiesterase inhibitor, but this is mostly at higher levels and therefore increases intracellular cyclic AMP, um, which helps with diaphragmatic contractility, which may help with asthma. It also stimulates dopamine beta hydroxylase and therefore helps synthesize norepinephrine mostly, and epinephrine a little bit as well from dopamine, which is a precursor molecule. So you increase catecholamine synthesis, so you end up with a sympathomimetic toxidrome from this exposure, whether it's coffee or via a plant. And then sort of the unique thing that it does is it antagonizes adenosine. And this causes both tachycardia, supraventricular tachycardia. So specifically, the one I have boxed there is multifocal atrial tachycardia, where you see 3 different forms of the P wave, each one conducting to different forms of PVCs. This almost uniquely happens with theophylline, toxicity or can potentially, I guess, happen with caffeine toxicity from a plant. We could treat these with beta blockers, despite the caution about beta blockers and stimulatory sympathomimetic drugs like amphetamines, cocaine, like we talked about yesterday. These actually can be treated. In fact, probably the treatment of choice is beta blockers for caffeine, methylxanthine, theophylline toxicity. And this is nicotine, tobacco, nicotinia tobacco. Um, I'll just say it will cause drooling, nausea, vomiting, potentially tachycardia. Most kids who eat these plants or even eat cigarettes vomit, and then they get a little toxic and a little drooly, but they usually don't have seizures. People who drink pure nicotine as a pesticide liquid, which isn't generally available anymore, can get quite ill with seizures and refractory arrhythmias. But just eating the plant is probably only mildly symptomatic. A couple of other plants to talk about is a tale of two hemlocks. On the first picture there is the death of Socrates, who for poisoning the minds of his students, he was sentenced to death by having to eat poisoned hemlock. And he died somewhat miserably soon after, I guess, the idea of this painting was pictured. But locally, we also have water hemlock. Despite the name water hemlock and poison hemlock, water hemlock is far more toxic. This is what they look like. Water hemlock has these bright, what's called umbrils, these white clusters of flowers. Poison hemlock has sort of smaller clusters. The toxin in water hemlock is, oops, what is it? Is sequoia toxin. The toxin in poison hemlock is connine. Both of these can potentially be assayed for by specialty labs. The stems and the roots are different. The seizures tend to occur from people mistaking water hemlock for some rhizome, like an onion or a carrot sometimes, and eating them and making them in a stew when they forage for them. These tend to produce refractory seizures. In fact, that initial article about seizures and death on a whitewater river trip was written by an Oregon State University medical school student back in the 70s who his comrades on his Whitewater River trip all died from foraging for these. They were unable to be rescued. Uh, Poison hemlock, we see more people eating these roots because there's these stems. They're nice hollow stems with purple blotches or spots on them, and it tends to form mild but incomplete forms of paralysis. Every once in a while, we'll see a kid come in who's been chewing on these or making a whistle out of it because it's hollow, and they're just weak and floppy and can't get up. And for the most part, supportive care is all that's necessary for these. And finally, there's a few poison beans out there that they love to test on. Now, we've seen one or two of these in the past, so I'm not saying they rarely ever happen, but they are kind of uncommon. They contain two very notorious toxins, abrin and ricin. The Jacarity bean has abrin in it. It comes from Abrus precatorius. The castor bean, from which originally was derived castor oil, a lubricant used in automotive products, has Ricinus communis and has the toxin ricin in it. Both of these are pretty nasty. Ricin historically has been felt to be the more toxic of the two, but we had a recent case 4 or 5 years ago of Abrin, which was quite severe and had severe neurologic deterioration and death. So either of these can cause deaths in small amounts. The key is if the bean is completely intact and you swallow it whole, your digestive juices won't dissolve it enough to release the abrin or the ricin involved. You have to chew it up and mash it up or pulverize it before you eat it in like a blender, which is what our patient locally did with abrin bean. They pulverized 200 abrin beans and ate it as a slurry. So I think they'll often say which match the ones to the right amount. Um, Castor bean is ricin, Jacarity is abrin. And this goes back to the famous like British umbrella death assassination attempt where the Bulgarian spy was shot behind the leg as he stayed near a bus stop by his assassins with a pellet that contained ricin. And because of that, he is the one and only person to ever die of ricin poisoning that's at least publicized in the literature, and everyone gets very scared of this drug. It causes this delayed onset GI effects, depression of the marrow, and multi-organ system failure. It's aggressive supportive care, nothing specific to be done. This is our case that we had. It was fatal. I think Rachel was the main person on it, but obviously a lot of us worked on a different case. We sent levels off to the CDC, and they had all sorts of imaging abnormalities in the basal ganglia and the posterior cerebrium and cerebellum as well. And they died slowly over about 3 to 5 days. And we documented it with levels that our friends there, Jerry Thomas at the CDC, was able to get for us. There's one more bean. Probably doesn't see anybody eating it, but it's the source of physostigmine. It's the stigma venenosum. Physostigmine, just to jog your memory, inhibits the enzyme acetylcholine esterase, which is the thing that breaks down acetylcholine and in the interneuronal cleft. And so you end up with more acetylcholine. It was used as the old Calabar, which is Nigeria, ordeal bean to weed out who were practicing witches. I'm not sure how effective it was at that. Many people ate them very quickly and vomited, and because of that, because they thought they might be guilty, perhaps escaped judgment of being poisoned by the Calabar bean. It produces a cholinergic toxidrome with bradycardia, as you might imagine someone who got physostigmine without having any cholinergic poisoning would have. So, a few minutes about mushrooms. We deal with a lot of mushrooms. We're probably the busiest mushroom center in the country. So you guys, I think, are pretty good at all of this. I'm just going to talk about a few that are kind of important that show up on tests. These are the 8 groups. Some people have expanded this to 10 and 12 groups. The big one that we worry about, of course, is amanita toxins, amatoxins that kills your liver. But there's also gyrometrin toxin that causes seizures. Those are probably the big ones to remember. Group 1 is the cyclopeptide, which are the Amanita phalloides, but also occurs in Galerina and Lepiota species, but not all of them. So just because it's an Amanita or Lepiota doesn't mean it would contain this toxin. The toxins are cyclic peptides, and they're specifically referred to as amatoxin to go along with the Amanita poisoning. I mean, that's the thing about plants is they usually name a toxin after the genus or species name sometimes. This is a multiphasic presentation. They're usually asymptomatic for 6 hours, which is why we say if they get symptomatic early on, they're probably not poisoned by amanita toxin unless they've eaten multiple different types of mushrooms. If they get sick hours later, then we start worrying about it. And by getting sick, they have this cholera-like illness with nausea, vomiting, and usually profound, intolerable diarrhea that drives them to seek medical care. After they recover from this, there is a latent period during which time their liver is slowly going through apoptosis, and eventually it's reflected by lab abnormalities and symptoms at about 48 plus hours. There's an assay that we can get from time to time that will show up as late as 48 hours. When you get to the sick part, it looks pretty much exactly like Tylenol toxicity or any other severe hepatotoxicity, rising transaminases, bilirubin, coagulopathy. These folks can develop a hepatorenal syndrome and hepatic encephalopathy very early on. They usually have elevated lactate and low phosphorus because they're consuming phosphorus in an attempt to regenerate their livers. There's treatment options available, but basically I like to think of it as 2 things you can do. You can prevent the liver from getting the toxin in the first place. And there's really only 2, maybe 3 things we can use for that. The things that I think potentially are testable are using high-dose penicillin or silibinin or silymarin, which is either available intravenously as silibinin or as a health food store additive as silymarin. Both of these interfere with hepatic uptake. Or you can block it on the way out, basically, because it undergoes enterohepatic recirculation. You could basically interrupt that by putting multi-dose activated charcoal in the lumen of the GI tract and binding up the toxin as it comes out of the biliary tree. Some people have gone so far as to recommend direct biliary drainage to augment this even further via ERCP or even surgical drainage. We don't really do that. I think multi-dose activated charcoal is more than adequate to accomplish this without doing something invasive. The next group is the gyrometrin group. These do grow locally, but we've rarely ever seen the true seizure toxins. The species is Gyrometra esculenta, or the false morel. It looks kind of like a crenulated brain, although not all of them look this way. The toxin is actually monomethylhydrazine, which is gyrometrin. And basically, gyrometrin is rapidly decomposed in the acids of the stomach to this intermediary compound MFH, and then it goes through slow hydrolysis in the liver to produce MMH, which is the same thing that's in rocket fuel that causes seizures by depleting GABA. And the way it depletes GABA is twofold. First, that it actually inhibits the conversion of glutamic acid to GABA directly, but it also inhibits the coenzyme for it, which is pyridoxal phosphate, which is vitamin B6, or the active form of vitamin B6, from being converted from the inactive form, pyridoxine, to the active form. So we do have sort of a mechanism for treating the seizures when they do occur, although they are quite rare and more common in the European varieties than the North American varieties of Gyrometra. You can give large doses of pyridoxine to try to overcome this blockade and therefore replenish the active form of vitamin B6 and therefore make more GABA as a GABAergic agent to stop seizures. But often while you're waiting for that to happen, or you're giving large doses of pyridoxine, you have to give a strong GABA agent. And if benzos don't work, you have to go up to barbiturates pretty early on. So seizure control, 5 to 10 grams of pyridoxine. Watch for any sort of organ system failure. This mushroom, Amanita muscaria, grows locally, pretty easily identified. When people call in and they say, I ate a big red mushroom with spots all over it, probably don't need that re-identified by an expert. That's pretty good description of what this looks like. It doesn't have the same toxicity as Amanita phalloides. It has two compounds in it, the isoxazoles, which are ibotenic acid, which is a stimulatory or NMDA receptor agonist, and then it's slowly metabolized to muscimol, which is a GABA agonist. So you have a stimulatory phase followed by a sedative or GABA phase when you eat these mushrooms. Here is glutamate being decarboxylated to GABA. Here is ibotenic acid being decarboxylated to muscimol. It's just knocking off an OH group. Rob and Mike Moss, when he was here, did a study of like 15 years of what we saw with this ingestion. Most cases of Amanita muscaria were pretty straightforward. Most of the toddler ingestions did fine. Nobody had any seizures or CNS excitation, despite its prediction that it might. One did get intubated, probably due to getting way too much benzos. Of course, they were worried about how agitated they were. It's similar co-species. Amanita pantherina is harder to pick up and need to be identified because they're kind of a white mushroom without the red cap. Most of these were not, accidental. They were more foragers than accidental toddlers. But again, some of them got intubated due to delirium and needed for sedation. But again, none of them had seizures. So it's usually self-limited. Toddler ingestions, we can watch at home and call back. If they do get agitated, benzos sparingly, Ativan perhaps sparingly for the excitation phase, because eventually you'll get sort of this double GABAergic stimulation when it's all metabolized to muscimol. And that's that. I saw there's a bunch of things popping up in the chat room, and I will try to address those. Um, it's all up here. So yeah, some mentioned this grows in Arizona. I'm sure it grows. All these weeds grow everywhere, even along the highways. Um, Crushed and injected aberrant beans and died. Yes, that was the case we had here. Maybe you had someone. I think there was another one in Arizona. You're right, JC. And we actually consulted with them because it came out like a few months after our case report. Um, and there's a link to some publication. I don't know if that's the other publication. And there's some that grow right outside the window in the Washington Poison Center office. Yeah, I know some of them. One of those photos was taken at my mailbox, so it just grows right outside everywhere. The Amarina muscarinas. Um, Anybody have any other questions about plants and mushrooms? I don't know what percentage of the test questions are likely to be plants and mushrooms, but they're certainly ripe for picking, like which ones cause tachycardia, which ones cause bradycardia, which ones cause cardiac arrhythmias, all that sort of stuff. They like grouping them together, making you pick out the one that doesn't fit into the group. Well, let me move along and talk about